Society of Specialists in Airway Management in Nigeria has held a second annual scientific conference with the aim of improving on research innovation, training and exposure to modern and emerging tools for contemporary airway management in Nigeria. The Society of Specialists in Airway Management in Nigeria was created to fill a gap in Nigeria. There has been a need for an airway management society in Nigeria to promote, teach and facilitate safe and standard airway management. The achievements so far and responses from participants at airway workshops and recipients of donated airway devices are testament to the fulfillment of their mission. The Society's collaboration have led to the establishment of 30 well-equipped stimulation centers across the 6 geopolitical zones in Nigeria. The Chief Medical Director of the National Hospital Abuja, Professor Mohammed Raji Mahmood, and Dr. Ugwuanyi Ogochukwu Charles, as the special guest of honor at the conference, harped on the importance of redefining the potentials of airway as an important component of healthcare management. They encouraged the Society of Specialists in Airway Management and our professionals to continue to improve on knowledge sharing to save more lives.
Talking about airway management is key to everything that the surgeon does. And in fact, it is key to any well set up ICU or critical care management. So for you to have developed airway management to this subspecialty, it's really, really commendable. And the NMA will want to encourage you to continue in that trajectory. At the national level, you must have noticed that there has been a current drive towards redefining and reinventing ourselves. And this is what our national president will always encourage, that people must continue to develop themselves along the subspecialties from improved care to teaming for patients in Nigeria. So it is very commendable. So once more, on behalf of the university, I thank the organizers here, and I welcome you all here. And I'm looking forward to development of this association towards higher capacity to achieve more in the future.
As SSAM. That tells me the caliber of people you have within yourselves here that will push the horizon of this association forward.
I want to wish you a very wonderful deliberation. I'm sure it will be a very rich conference, and I wish all of you that have come from far and wide after this program to go back to your homes and families in peace and in good health.
While speaking to journalists, the president of the society, Dr. Aderonke Adeshiyan, said the society has provided equipment to various hospitals all over the country and training to their health care professionals, which has reduced related deaths.
So airway management really is about the fact that when you go for a surgery or you are unconscious, you are not able to control how your breathing is. So we are now trained people to know how to help you when you are in that situation, because somebody that cannot take in oxygen dies, as we all know. So with this training, all healthcare professionals now know how to properly take care of patients so that they do not die from breathing abnormalities. It's been a great impact because places, for example, there are some equipment that we didn't have before, but this society has improved that because there are donations. They didn't even have to buy those equipment. We had donors that were able to give this equipment to us, various equipments, and we're able to distribute it to all places in Nigeria. So the people that were dying before as a result of bad airway management or because they didn't have the equipment or the professionals didn't have the training, they are now, there's better improvement and less people die. People are not dying from those things again. So we are looking forward to even much more improved care.
Talking about ways to improve airway management in Nigeria. So many people are aware of airway management in Nigeria. Healthcare workers, they know about the importance, because if you lose the airway, you lose the patient very easily. So awareness of airway management, yes, but knowledge of how to manage the airway, skills, there's still a gap. Equipment, there's still a gap. So those are the gaps we are trying to bridge by this conference, by having airway management workshops, etc.
The Secretary, Local Organizing Committee of the conference, Dr. Johnson Udodi, while acknowledging the feats of the achievement in airway management, said there is room for improvement as well as more government involvement.
Everything that is involved in saving lives, especially in emergency cases, is everybody's business. And most times you see that all hands are on deck to ensure that the best outcome is achieved. Of course, there's always a lot of room for improvement in our own resource-poor environment in Africa, just like other parts of the world that are not that do not have a lot of resources. There are challenges and there are gaps that must be closed. And this conference and the activities of this society are geared towards helping to close that gap, to make sure that the best outcome is achieved with the little resources that are available.